Hello. Please feel comfortable. Okay. Oh. You're struggling with hair loss? I'm so sorry about that. It says here that it's only in an area in a specific. Can you show me? Okay. So it will be the frontal part only. I'm sorry about that. Yeah. And when did you notice the fall and the balding on the area? A few months back. Have you tried anything to solve it? Hair growth shampoos? Okay. Let me check the area in particular. And you haven't noticed any change whatsoever with the shampoos? Oh, your doctor recommended to go to a dermatologist for this. Yeah, actually, it's best for this. Sometimes our patients think that a dermatologist is only for the skin and forget that our heads, it's also our skin. Our scalp is part of our skin. So let's take a look, okay? So out of, I see, especially on this part, which will be what we call the little M in our forehead area. So it's mostly here and here. Now what I want to check out is that there is no issues with infestations such as lice or any little bugs like that, or a sign of scalp illnesses like psoriasis, dandruff and such. Okay. Well, the area looks clean. I don't see signs of infection, redness present, nothing like that. Your scalp is actually well taken care of. No dryness present either. This area looks good too. This one in particular has more hair loss than this one. This one seems that it just started. It started on one side first, then moved. Okay. Now this looks like a pattern of stress-induced hair loss. I don't see any signs of disease, infestation, anything like that. Your scalp looks quite healthy. Not as dry as I will imagine for this type of issues. What type of shampoo do you normally use? How about hair products like gel, spray, anything like that? Okay. Yeah, definitely the issue here, I'm almost certain, is caused by stress. This is something that happens sometimes. Did you give birth in the past 6 months? Okay, because yeah, when a woman gives birth, the hormones change drastically. From 1 second to the other, the hormones start changing, shifting, and it's a whole storm of hormones in their bodies, along with the stress of bringing a new life. This causes hair loss. Hair loss that will be reverted once the hormones stay still, which normally start happening after 4 to 8 months. Some cases a little bit longer. So in your case, that seems not to be the issue. And I was seeing in medical history that you eat quite well. There has no issues here of extreme fasting or anything like that. And your diet seems quite good. So how do you think is your stress levels? Okay. Well, this is definitely something that can be fixed. Yes, it's something that we can do today. It's going to take a little bit of time, at least 3 sessions, for you to start notice the growth. And the problem here is the underlying issue, which will be the stress, because we can fix stimulating your scalp for the hair to grow back. But if you don't take care of the stress that you are currently living in, this is something that is gonna continue happening. So you might want to have a chat with your health provider, maybe have some resources for therapy that will help you relax, manage all the stress that you're currently living with, and I believe that that will be great. How is your sleeping schedule? Do you sleep enough? How many hours? Well, it will be best to have 8 hours. Yeah, because at night when we are sleeping is when our whole body starts repairing itself. And if we are not sleeping and we are living with stress, well, you know, our body just goes into the storm and it cannot fix the issues that are happening here. So in your case, it's something that I have treated here in our clinic, stress-related hair loss. And we have a very good therapy that works wonderful for this, which is radio frequency. Let me show you. This is the tool that we use. We use it to stimulate these areas of your scalp so the pores start growing back the hair follicles that fell off due to stress. And again, if the stress continues, this is gonna keep going through your whole head. So let me show you. This doesn't hurt at all. It does make a little summing sound, but it's very pleasant while we do the treatment. And with 3 sessions is when we are seeing results that the hair follicle starts growing back to normal. Okay, so in your case, I want to try first 3 sessions of 10 minutes, and from there see if he's going to be needing a little bit more or go with another therapy. Okay, so you're ready to do it today? Very good. So let's start by cleaning the scalp area. Now we want to declog all the pores in your scalp here, okay? I'm sorry. What this is going to do is clear up the pores. Sometimes they get clogged by sweat, the shampoos and conditioners that we use too. Yeah, quite pleasant, isn't it? Your hair is gonna end up a bit oily, but once you take a shower, it should clear up, okay? But it's necessary to do this cleanup first. Now we're going to start on the lowest level, and from section to section we're going to be spiking it up, okay? Let's do a little test. It's not going to hurt. It's going to feel a little bit tingly, okay? Ready? Okay, here we go. Yeah, it feels a little bit cold, isn't it? It does feel nice. Okay. So we are doing here is sending some electricity into the pores, your capillaries, so they get the wake-up call to start working and creating hair again. So it's gonna start growing like a little root. Just need to give it a little time for it to work. Yeah, it gets a little bit tingly. Yeah, that's the electricity going through the skin. But you shouldn't feel any discomfort or pain, okay? That is important. Okay. In the next session, since we don't have to do the consult, it's gonna take around 15 minutes. Oh, I know, I'm sorry. That's getting a little bit too tingly. Want me to give you a little break? Okay. Let me spike it up a bit more. Still doing good? Okay. Now some of my patients start noticing a little bit of growth after a week, but it all depends on the person, their genes, family history with hair. So sometimes it's fast, other times takes a little bit more time to do it. So by the end of the week, you're gonna might be starting to notice it, okay? But if by the second week we don't see any improvement, we're gonna have to switch to a different kind of treatment, maybe something more aggressive, not in the sense that it's gonna hurt or anything like that, but a stronger treatment for reactivating your hair follicles, okay? Let me give it a little break here. I'm gonna massage the area. It's an exercise that I'm gonna send you to do at home every day after taking a shower or washing your hair. You can do it by taking a shampoo or shower, cleaning your head. I'm gonna show you. Let's say that this is shampoo. This is a hibiscus cream for the hair. You're gonna be doing this. Like you're scratching the area, but not with your nails, with the tip of your fingers like this, pressing. Can you feel the pressure that I'm putting into your scalp? And that is how you're gonna be doing it for at least 2 minutes. If you can do it for a longer time, that will be great. 3, 5 minutes. 2 minutes, that's good. This is gonna help you with this. And you can do it with anything but something that is slippery, like shampoo, conditioner, hair cream, hair gel. Okay. There we go. Let's continue. I can suggest you some exercise to help with stress, or I can refer you to a very good therapist that is quite knowledgeable of this type of situations, the management of stress, and it can help you a lot. Yeah, I sometimes send some of my patients that suffer of stress-related hair loss, and they have helped them. Yeah, sometimes we cannot remove the stressors from our life, but we can learn tools on how to manage it so it doesn't affect our body and our minds. Yeah, like letting it go. You're right. Yeah, you like the information? Okay. I'm gonna tell my assistant to give it to you with your information booklet on how to do the massage. It's quite self-explanatory as I was doing it earlier, but in case that you need a reminder, okay? How's the tingliness going? You don't feel it anymore? Yeah, that's because your scalp is getting used to the sensation, so it doesn't feel odd for you anymore. Very good. I'm gonna crank it up a little bit more to end the session for today. How's it going? You felt that. Well, we will see. In the second session, you're going to take 1 session per week. That means that I'm going to see you again in 7 days. You can choose the hours with my receptionist, but it's necessary to do it every 7 days. There we go. We don't want to overdo it either, because the hair follicles can get a little shock and die. We don't want that. Okay. So I will be giving you the information about my colleague. She is amazing for this type of situation, and I believe that it's gonna help you greatly. We're gonna fix the exterior part of the issue, which is the hair loss, because I know that it's also adding to your stress, which is a bicycle cycle. So we need to fix one thing and fix the other. Okay, so do you have any questions about the treatment or how the sessions are gonna be? Well, the massage, it is very important to do it every single day, because right now we gave them a jump start with the electricity, but at home it's very important to still stimulate the area so it starts growing. Yeah, it has to be daily, preferably before going to bed. If you're not someone that tends to shower or wash your hair every single day, you can do it just with plain water in the area, but it's something that needs to be done. So the treatment can work properly as it's intended. Okay, so anything else that I can do for you today? Very well, so you can go with my receptionist. She's going to give you your information booklet about your issue and the treatment that we are doing. It's going to be more informative about all the do's and don'ts about it, and also the information for my friend therapist. It was a pleasure helping you, and I will see you in 7 days, okay? Of course, please take care. Bye-bye. Hello. Okay, let's check it out. I'm so sorry. You're struggling a lot with stress. It says here that a few weeks, couple of months, you had a treatment for lockjaw due to stress. Okay. How did that go? Help for a little bit? Okay. Very good. Let me just clean my hands. Let's check out. Is this the same area that you've been struggling with? I'm sorry. Just move through all your head. So it started in this area and goes up into a migraine. Okay, that's not good. And you've been trying medication too? Not helping? Well, sometimes when medication over the counter or something that doctors give us is not helping, it's because the issue is not physical. It's not something like, oh, you're not eating well, you're not sleeping well, or there is an underlying illness. It's mostly common due to stress. And of course, the lack of sleep also is not good for that. Okay, we're going to be feeling the areas, and then I'm going to try to decide which treatment will be best for you, okay? Very good. So if it gets a little bit uncomfortable, please let me know. You shouldn't be feeling pain, okay? Right here. Okay, I need you to open your mouth very softly. Like this, like it's hanging out. Okay? I know it's kind of hard to try to relax it. Let's give it a chance. I would like your jaw to get a little bit mobile, so I can move it a little bit. Yeah, it feels really tight on this area in specific. What kind of medication have you been in? Yeah, that normally helps with the pain, but it doesn't fix the underlying issue, which would be stressors. So we need something else to help it soothe and get well, which is a therapeutic massage. Okay. Yeah, this area in particular where your jaw connects to your skull right here in this circle is where it's mostly locked. That's where you feel that it's heavy, your jaw. It feels like you have to keep pushing and feels like it's very, very heavy. Okay. Well, for that, we're going to be using a acupuncture without needles, okay? we're going to be using this tool here to press into these areas, into these acupressure points. That's going to help you soothe the area. It might feel uncomfortable at first, but believe me, it will start working out, okay? Now, so you tell me that it goes up into the side of your head, giving you migraines, that this migraines last for several hours, days. Okay. Does the light bother you, or the sounds? Yeah, when the light is starting to bother you and you feel like you need to be in a darker place, or that the sounds is just too much, people talking, the TV or anything, yeah, it's definitely a migraine. Now, it's a tension migraine. This is definitely because of your jaw, the amount of strength that you're pushing here is going through your head. So I don't think that it's nothing to do with and if it's physiological, it's mostly the stress that's coming from your jaw to your head because you're squishing too much the area. Okay, so once we fix this part, your head is gonna start to feel lighter and lighter, and eventually the headaches are gonna dissipate. Okay, let me see here. I have a very cool trick here that is gonna help you in the meantime, which is I'm gonna put a bandana around your head. It's gonna be tight, but it's gonna help you a lot with the headache that you're feeling. Yeah, it's gonna constrict the blood vessels, and at first it's gonna feel too tight, but then you're gonna start feeling the relief of being tight. Okay, you can actually do this at home whenever you have a migraine. Just put a bandana as tight as you can, and you're gonna leave it for at least 10 minutes. Okay, yeah, as tight as you can, or as much as you're able to endure. Yeah, this way you don't have to be taking medication that often, because when we start abusing this medication, it's not working with time, especially with ibuprofen. Yeah, you better want to avoid it, because that will cause you ulcers in your stomach. Yeah, I had a client that was taking ibuprofen every single day for years, about 600 milligrams per day, and she developed a very nasty ulcer in her stomach. Yeah, you might want to take that into consideration. Okay, I'm going to be applying this. That is going to help the needle to move a little bit more softer. Okay, this is by Lancome. It smells great and it feels great in the skin. It's a bit oily, but it's necessary for this to work. The last time you had a massage, deep massage, yeah, it does help, but it doesn't go too deep. Okay, so we're gonna start on this side because it's the area that feels more tight for you. Okay, We're gonna be pressing into the area. 5, 4, 3, 2, 1. Very good. How did it go? Yeah, a bit uncomfortable, but can you endure it? Good, good. Here we go again. Now I'm gonna be going deeper. 5, 4, 3, 2, 1. Good. Okay, now I want you to close your mouth. Now with your teeth, like you're biting something. Okay, here we go. 5, 4, 3, 2, 1. Good. Might leave a bit of marks, but they're gonna fade away. It depends on the person, but half an hour, sometimes less, sometimes a little bit more. 5, 4, 3, 2, 1. Again. 5, 4, 3, 2, 1. And I'm releasing. Okay. Let's unclench your jaw. Relax. Let's move this side. 5, 4, 3, 2, 1. Good. Oops, I'm sorry. I slipped a little bit too much. 5, 4, 3, 2, 1. Good. Once again. 5, 4, 3, 2, 1. Good. Okay, we're gonna be doing the same as in this side. We're gonna bite. There we go. 5, 4, 3, 2, 1. Release. Good. Now, lose your jaw. Soft. How is that headache going? See? Oh yeah. I'm gonna remove the bandana in a little bit. 5, 4, 3, 2, 1. Good. Yeah, it only works when it's a tension headache. When we're not sleeping well, we're a little bit stressed, and it's with you is the tension of your jaw. But it doesn't work when it's, let's say, a high blood pressure headache. That doesn't work. Or when it's an underlying illness like an infection, it's not gonna work. Okay, this is for only tension headaches or migraines. Yeah, the bandana. Here we go again. 5, 4, 3, 2, 1. Good. Try it a little bit. Let me just apply more. Do you normally fast? Like, yeah, fasting, like you spend a lot of hours without eating? Sometimes when people are fasting, they don't eat for 16 hours straight, sometimes 20 hours straight. And if they do it too often, their jaws are not getting enough exercise of the biting sensation, and it can develop this issue too. Okay. Yeah, just something to point out. It's something that can happen with this certain type of issues on the jaw. Okay, we're gonna restart in this area again. Just relax there. I know I say relaxing. I know it's hard for you. I'm sorry. Just accustomed. Okay. 5, 4, 3, 2, 1. And releasing. Now on this part, I'm going to be pressing a little bit more, okay? Ready? Oh, there we go. 5, 4, 3, 2, 1. How did it go? Did it hurt? You okay? Okay, let's continue. 5, 4, 3, 2, 1. Okay. We're gonna do the same here. Ready? 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. Okay, good. Very good. Let me remove the bandana now. Sometimes when we remove it, the headache might come back. That's when we know that we should leave it for longer periods of time. But no more than half an hour, okay? We don't want to cut the circulation of blood in the area. Okay. I'll leave it. And if in 5 minutes it comes back, the headache, with the same strength, it means that there is something else going on, okay? But if the headache is just small and mild, we can put it again. Yeah, it can be, as I was telling you, an infection, high blood pressure, or any other situation like that. Okay, let's go here again. 5, 4, 3, 2, 1, and releasing. 5, 4, 3, 2, 1. Good. Let's give it a rest for a bit. I'm gonna massage the area. Just wipe the excess of the oils. I use a bit of aloe vera. This is magnificent for this type of pain. How does your jaw feel? Sore? It could feel sore, yes, but you shouldn't be feeling pain. Yeah, definitely because of the nail that's going a little bit deep. It can happen. But shouldn't be feeling painful that it's bothersome. Okay. I'm going to apply a towel on top of you. This is going to help you freshen up so we can continue with the acupuncture therapy. It's going to feel very cool on the face. Okay, and I'm going to apply some mist water. Distilled water with rose water, okay? to help soothe the area. Then I'm going to apply a little bit thermic light. Okay. I'm going to feel a little bit warm. That's okay. This is especially good for the area of the jaw, and it feels tired. I especially do this in knee therapy. It helps a lot, especially on this area here. How does it feel? The warmth and the coolness of the cloth feels great, isn't it? Yeah. There we go. Very good. Okay. Oh, sorry. Very good. Okay, perfect. I'm going to put the mister again. Feels more relaxed? Yeah, definitely. Okay. Here we go again. It's gonna feel more cool because we apply the thermic light, okay? Okay. Okay, we're going to take it off. How do you feel with the headache? Did it come back? Barely? Do you want me to put the bandana again for the rest of the session? Yeah? Okay. I'm not gonna put it too tight this time, but since it helped, it's definitely a tension headache, so the bandana is gonna help you, and you can do it at home too. Yeah, any type of bandana, anything that covers your whole head and you can make a knot, is what's gonna work. But just remember that this is only for tension headaches, okay? If you're having a fever or anything like that, you need a doctor. Yeah. Okay, you notice that I didn't put it too tight this time? That's how you should do it at home too. Okay, we're gonna do now an exercise with your jaw. We're gonna try to loosen up and do some circles. It's gonna feel weird, and I wanna feel if it's clocking. Sometimes it clicks. Yeah, there is this thing called TMJ that only a dentist can treat. Yeah, and what I specialize is for stressors, relaxation. But when it's TMJ, you definitely need a doctor. A dentist can help you with that. Yeah, that's when it's clicking. Your jaw is clicking, and it's difficult to open up your mouth. Okay, let's continue. Okay. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. Good. You're not twitching anymore, so feeling better, huh? 5, 4, 3, 2, 1. Yeah, that definitely tells us that it's due to stress. So you might want to work on that, on the stressors in your life. I know it can be difficult. This is like a band-aid that's going to help you with the physical issues that is causing the stress. But the stressors are going to continue, so you might have to deal with it. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. Good. Now I'm gonna do it on this area. I'm gonna be pressing from down up. It's gonna feel odd in this area, okay? Ready? 5, 4, 3. Okay. Yeah, that was a bit too much. Okay, I'm gonna try to do it a bit more slow. 5, 4, 3, 2, 1. Better? Okay. Oops, sorry. 5, 4, 3, 2, 1. Good. 5, 4, 3, 2, 1. Good. 5, 4, 3, 2, 1. Good. 5, 4, 3, 2, 1. Let's do another exercise. I'm gonna open like that, okay? Okay, feels better. Feels better for you? Yeah, definitely. We help the muscles of the jaw to relax a little bit more. They were very, very stiff. Okay. It's time to remove the bandana. Remember, we don't want to leave it for too long. 2 minutes is enough. For the second time. Yeah, so I was telling you, it can be any type of bandana. There's some that they sell on Amazon that has chia beads on it or something like that. To be honest, it feels nice because of the seeds and you can warm it up. But to be honest, a simple bandana or even a ribbon that is a little bit more white, you can just put it and it's gonna work great. Just need to make sure that it covers all this area in your forehead. Okay, I'm gonna soothe the area again. So it definitely work. So this might come back if we are not dealing with the external stress, but you can do something to prevent it and use a mouth word when you're sleeping. You can buy this at any pharmacy or even Walmart, and you just put it in your mouth when you're going to sleep, and that is going to prevent you to bite too strong when you're sleeping, which is what tends to make this area sore and tight. Yeah, sometimes we don't notice that we're doing it, especially at night. Okay. So I'm gonna apply more aloe vera. Just remove the oil. This aloe vera is for the acupuncture points, so it fades away faster, okay? So, how do you feel? Yeah, I can see it in your face. A bit more relaxed. I'm happy to help you. Okay. There we go. So, you could take this therapy, I would say it could be every week, but I do suggest every 2 weeks. Let's start by that. And if you notice that this discomfort and pain keeps coming back, let's say within days, you might want to go to a doctor, to a dentist, because it might be TMJ. Yeah, I'm not able to diagnose it because I'm not a medical doctor, not a dentist, but it's something that it's very common for this type of issues too. Okay, is there anything else that I can do for you? It was my pleasure. So if you feel that it's coming back in, let's say, a week and a half, you can come back and we can do another therapy session for you. Okay, take care. Have a great time.